Diabetes Explained, Early Signs, Foods to Eat and Avoid, and Expert Advice. Welcome to Nutigood HealthBook, your trusted companion on the journey to better health in your golden years. Today, we're exploring diabetes, a health challenge affecting millions worldwide. Let's begin with some eye-opening numbers. In 2021, over 537 million adults globally were living with diabetes, and this number is projected to rise to 783 million by 2045. Diabetes not only disrupts blood sugar levels, but silently damages your heart, kidneys, eyes, and nerves. But what exactly is diabetes? What causes it, and how can you effectively manage it? Stay tuned as we dive into these critical details in today's video. What is diabetes? First, let's clearly define diabetes. Diabetes, medically known as diabetes mellitus, is a chronic metabolic disorder characterized by consistently high blood sugar, glucose, levels. In healthy individuals, the pancreas produces insulin, a hormone essential for transporting glucose from the bloodstream into cells, fueling the body's activities. However, in people with diabetes, two main issues occur. Either the body stops producing sufficient insulin, or cells stop responding effectively to insulin. This leads to glucose buildup in the bloodstream, gradually harming the heart, kidneys, eyes, and nervous system if left uncontrolled. Types of diabetes. Now, let's break down diabetes into its three main types. Type 1 diabetes, accounting for 5 to 10% of all cases, this form occurs when the immune system destroys insulin-producing beta cells in the pancreas, eliminating insulin production. It often develops rapidly, usually in children and young adults, and requires lifelong insulin therapy. Type 2 diabetes, making up over 90% of cases, initially involves insulin resistance. Cells fail to respond properly despite adequate insulin production. Gradually, the pancreas becomes exhausted, reducing insulin output. It develops silently, mostly in adults who are overweight, inactive, and consume diets high in refined carbohydrates. Gestational diabetes occurs during pregnancy when placental hormones inhibit insulin's effects. Usually, it resolves postpartum, but increases the mother's risk of type 2 diabetes later in life and predisposes children to obesity and metabolic disorders. Understanding each type's mechanism and management strategies is essential to crafting effective treatment and lifestyle adjustments. Risk factors and causes. Let's explore scientifically validated risk factors. 1. Genetics. Major studies, including the UK Prospective Diabetes Study, UKPDS, 1998, indicate that having a parent or sibling with type 2 diabetes doubles your risk, highlighting genetic predispositions affecting beta cell function and insulin response. 2. Overweight and obesity. According to the National Institute of Diabetes and Digestive and Kidney Diseases, NIDDK, visceral fat accumulation reduces insulin sensitivity. The EPIC Interact study involving over 340,000 Europeans showed a 5% increase in BMI raises diabetes risk by about 20%. 3. Physical inactivity. WHO research indicates just 30 minutes of brisk walking daily significantly improves insulin sensitivity by up to 40%. 4. High refined carbs and sugar intake. Regular consumption of sweets, white rice, and processed noodles forces the pancreas to work excessively. A 2020 ADA meta-analysis linked over 50 grams of refined sugar daily to a 30% higher type 2 diabetes risk compared to under 20 grams. 5. Aging and beta cell decline. Natural aging reduces pancreatic insulin production by 1 to 2% annually after age 45, elevating diabetes risk. 6. Additional factors: chronic stress, poor sleep, and conditions like polycystic ovary syndrome also elevate insulin resistance. Though genetics and aging are inevitable, maintaining a healthy weight, balanced diet, and regular exercise significantly mitigate diabetes risk. Recognizing early symptoms. Diabetes signals its progression through clear symptoms. 1. Frequent urination, especially at night. 2. Excessive thirst. 3. Constant hunger despite weight loss. 4. Persistent fatigue. 5. Blurry vision. 6. Numbness and tingling in extremities. 7. Slow healing wounds and recurrent infections. Recognizing these early helps prevent severe complications. Impact of diabetes. If uncontrolled, diabetes causes serious complications. 1. Cardiovascular disease, including heart attacks and strokes, due to increased inflammation and arterial plaque. 2. Kidney damage progressing to chronic renal failure. 3. Retinopathy, potentially leading to blindness. 4. Peripheral neuropathy causing numbness, ulcers, and severe infections, sometimes necessitating limb amputations. 5. Autonomic neuropathy, disrupting digestion and blood pressure regulation. Effective glucose control reduces these risks significantly. Recommended foods. A diabetic-friendly diet includes 1. Complex carbs, whole grains, oats, and sweet potatoes stabilize blood sugar levels. 2. Soluble fiber, broccoli, kale, peas, and beans slow glucose absorption. 3. Lean protein, salmon, chicken breast, tofu, and eggs stabilize blood sugar and support muscle health. 4. Unsaturated fats, olive oil, flaxseed, walnuts, chia seeds, and avocados enhance insulin sensitivity and reduce inflammation. 5. Low glycemic fruits, apples, pears, grapefruit, and kiwis provide antioxidants without spikes in blood sugar. 6. Hydration. Drink 1.5 to 2 liters of water daily. Unsweetened green tea and diluted apple cider vinegar also support glucose control. This balanced diet helps manage blood sugar and protects overall health. Foods to avoid people with diabetes should strictly avoid: refined sugars and sweets, refined starches, saturated and trans fats, fried foods, processed snacks, alcohol, causing blood sugar fluctuations and organ damage, processed foods, sausages, canned goods. Avoiding these significantly stabilizes glucose levels and prevents complications. When to see a doctor? Promptly consult a doctor if experiencing classic symptoms: frequent urination, excessive thirst, unexplained weight loss. Blood tests show fasting glucose greater than or equal to 126 milligrams per deciliter, or HbA1c greater than or equal to 6.5%. Suspicious complications: slow healing wounds, increased numbness, blurred vision. You belong to high-risk groups: obesity, metabolic syndrome, family history. Regular screenings and early interventions effectively manage diabetes. Conclusion and expert advice. Diabetes management is a lifelong journey, not a sentence, but a motivation toward healthier living. Health experts emphasize 3 pillars: balanced nutrition, regular physical activity, and strict adherence to treatment plans. Set achievable goals. Reduce body weight by 5%. Exercise at least 30 minutes daily. Monitor blood sugar regularly and maintain medical checkups every 6 months. Each step forward is a significant success in managing diabetes.